Well, joining us today is Dr. Sandeep Bagla, interventional radiologist from Vascular Institute of Virginia, and he's here today to talk about prostate artery embolization, enlarged prostate, and the incredible minimally invasive treatment for BPH. Thanks for being here today. Thanks so much for chatting. You know, every time anyone talks about prostate, and the guys in the room get all nervous and say, I'm not 50 yet. Do I need my prostate checked? You know, I want the doctor with the smaller hands for. But tell us about BPH, what it's all about. I mean, we joked earlier about the commercial. It's not a going problem. It's a growing problem. I guess as we all get older, our prostates grow?
Yeah, absolutely. So benign prostatic hyperplasia, or enlargement of the prostate, it's really a condition that if you live long enough and you're a man, you're going to get this condition. So you're used to hearing about these symptoms. Those symptoms are things like going frequently, getting up at night to urinate, basically not able to urinate as strong as you used to, or starting and stopping. And it's not a cancerous condition. It's a benign, non-cancerous condition.
Okay, so I mean, how do you know that? Is there a difference? I mean, is this something you look for in a normal test, or?
So this is something that most men just notice on their own, or wives of men will notice, and men will be getting up at night more frequently, and it just comes to their own attention. They usually bring it to their primary care doctor, and that's usually how it's found about.
Okay, so this is a non-cancerous situation. But there are treatments. I guess there's therapies. That's the good news.
Absolutely. So the traditional therapy are medical therapy, so medications like Flomax and things like that that many people have heard of. And then over the years, over the past 30 or 40 years, surgical therapies have really come out. And those really involve putting a catheter or something through the penis to actually resect part of the prostate and make the channel bigger so men can urinate easier. The problem with those therapies, unfortunately, is that they have a lot of complications. So this is where prostate artery embolization that we're going to talk about actually fits in.
Okay, so how does this procedure work? Is this a hospitalization type of thing? Is this something you need to go in as a day procedure?
Yeah, so this is an outpatient daytime type procedure, and it's performed through one needle hole. There's no incisions. And it's actually performed minimally invasively, and nothing actually gets inserted through the penis. So there's no risk. And that's a good thing, of course. It's obviously much better to have it done that way. And nothing's put in that way, but we do go into the arteries or the capillaries that go to the prostate. And when we do that, we inject these little microscopic beads that shrink the whole prostate down. And when the prostate shrinks down, it basically widens the passageway so urine can easily flow through the prostate.
Oh, wow. So is it every patient, this an ideal situation for them, or is there different patients, different procedures?
Sure. So actually most patients, more than 90% of patients who have an enlarged prostate would be a candidate for this procedure. We generally see this in men who are over the age of 40 or 50 years old, who have worsening symptoms. So once those symptoms get in the way of their life, as long as they have an enlarged prostate and they have those symptoms, they would generally be considered a candidate for this procedure.
Wow. And you said an outpatient type of procedure?
Outpatient, doesn't require hospitalization, no catheterization. So really, from a minimally invasive standpoint, it serves a huge advantage over the traditional surgical options that patients have to go through.
Now, what about how long is this? Is this something that has to be redone? And if you were a younger guy and you had this procedure done, is it a lifetime? Is it
a great question. So right now, actually, just in 2017, we actually got our first release of long-term data. And the long-term data actually shows that the procedure is as effective as other procedures that have been around for years. And there is a possibility, of course, that the procedure may need to be done again. The man, of course, keeps his prostate, and it may grow slowly over some time. That's no different than any other procedure that men will go through for prostate disease. So if you were to get, say, a Roto-Rooter or traditional surgical therapy, there is, of course, a chance you may need treatment in future. And the same with prostate artery embolization, or PAE, which is what we call it. Down the road, if you live long enough, 5, 10 years down the road, you may need to have this minimally invasive procedure done again so that you can get your life back to normal.
Okay, and then what if you have this condition, and let's say it does maybe transition, or could it become a cancer situation later on? Is there any impacts if you had this procedure and later on implications?
Great question. So there's really no implication that if a patient should develop cancer later on, this should interfere with them. In fact, the prostate may be smaller, and it may actually make treating the cancer somewhat easier in certain conditions, but there really is no relationship between the two.
Okay. All right, so where can we get more information on this procedure?
Absolutely. So we have a website, just surprisingly funny name, of course, pbetter.com. So if you can go to that, or you could check us out at VA Vascular Institute. We're at Vascular Institute in Virginia in Woodbridge. and give us a call down there as well.
All right, Dr. Bagla, thanks so much for being here today.
Absolutely.
It's a good subject. You know, a lot of people get a little blushing around here, but we're having fun with it. And I think this is good news because this is minimally invasive. It can probably help a lot of men.
Yeah, great.
All right, thanks so much for being here. We got more Let's Talk Live coming up right after the break.